As the hospitals in New York and other hotspots take a deep breath and try to regroup after getting overwhelmed with COVID cases, Dr. Fauci warning yesterday that reopening the country too soon could have devastating consequences.
There is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically, will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery.
So it all begs the question, if we do see a second wave that approaches the severity of the first, if not even worse, will hospitals be able to ratchet things back up to deal with it? And what about the heartland? Cases there, they're on the way up. That according to an unreleased report from the CDC. Trump's own task force saying that many areas of the country are seeing a spike, especially in the middle of America. And this map shows those locations that health officials particularly concerned about. Included in that map, you'll find Charlotte, North Carolina, the site of the Republican National Convention that the president, as of now, still hell-bent on holding. I want to bring in my guests to discuss all of that and more, including testing and how more and more kids are now getting sick. Dr. Cioe-Pena, an emergency room physician from Northwell Health System. He's also the system's director of global health. Doctor, as always, I appreciate the time. Let's start off with the kids because for a lot of folks, we thought there was one portion of the population, the youngest among us, that were exempt, if you will. Maybe they could have been carriers, but their health wasn't in jeopardy. And we're seeing case after case here, albeit a tiny overall number, but still a growing population that says maybe not. Talk about how concerning and how much of a game changer that could be.
Thanks for having me again. And it is a very big game changer, I think. We have thought of children as like one of the engines of spreading the virus, but we've been relaxed in saying that overall they've been largely unaffected in terms of fatalities or serious illness. Unfortunately, this new detection of this syndrome is part of the now the picture that we have to do when we do risk assessments for schools and for opening up society, that children are not as spared as we thought. I do want to emphasize it is a small fraction or percentage of cases, but it's pretty serious outcomes. And so it does change, I think, our outlook on the pediatric population.
You know, there was a back and forth, and I'm not going to drag in the politics of it, but humility came into it. And I thought it was notable, and you've said this for a while, Dr. Fauci echoing it, we still don't know so much about this virus. And isn't that really still the case here as we're in now mid-May?
Yeah, I think, this is a virus that didn't exist 6 months ago. And so medicine has had to do a very quick kind of learn on the fly. And based on our knowledge on previous coronaviruses, we didn't have as extensive a population infected as we do with COVID-19. So SARS and MERS were lessons, but they were in much smaller groups of people infected. And we're seeing so many other things other than respiratory complications now. Some of the larger ones, the clotting issue and the neurologic issues, we have to watch very carefully. And so it's an incomplete understanding of the virus, and we're learning as we go, which is always at a disadvantage when you're dealing with an epidemic.
I get so many questions, Doctor, about testing, and I want to read one email that came in from a member of the audience, Cordell. He writes that 2 of my doctors have told me that COVID-19 test results are at best 80% accurate, which means 1 in 5 persons tested could have received an inaccurate result. Please address the issue. If you could speak to testing and then also the antibody testing, who should still get tested right now? Because there seems to be mixed messaging. And then moreover, who should go to get an antibody test, especially given the error rate we're looking at right now?
Yeah, and so not all tests are created equal. So that's one of the most important things is when we're looking at testing, there's the rapid test, which tends to be less accurate. There's the full kind of COVID-19 swab, which is the longer term test, it's less quick results, and then the antibody testing. The COVID test itself is very accurate when it's a positive result. If it's not a rapid test, it's a very accurate result. So if you're positive for COVID-19, that means that you either had or have a COVID-19 infection or SARS-CoV-2 infection. The negative result can be falsely negative. One of the biggest risks there is how good the swab is and whether you get a good enough sample. So it's very operator dependent. So that's one of the concerns, but we do see false negative rates that are around 20%. The antibody testing, again, there are so many manufacturers of antibody testing. Some of them have been the FDA has warned are just frankly fraudulent tests. They're starting to tighten that up. I will say that it is useful to know kind of the number of people that didn't get tested for COVID-19. Once we have a reliable antibody test, it will be useful to know that number of who's antibody positive.
There's a lot of people watching that have kids, whether they're in, kindergarten, elementary, through high school. I got a kid going to college, and for these schools to make determinations about what the fall is going to look like, if they're going to open their doors, and if so, how, I would assume data is going to be so critical about how many people have it, how many people have had it in the past here, tracing. Talk about the data points that, for example, that you guys use, but more than that, that schools, for anybody watching me, wherever they are, what kind of data they need to have to make calculated judgments about what to do next.
Yeah, the big questions are how protective are these antibodies going to be, and then how long are the antibodies going to last? Right now, our hope is that the antibodies will act similar to either the common cold coronaviruses or perhaps even SARS or MERS, which conveyed anywhere between a year to lifelong immunity. And provided some protection against getting sick again. If that's the case, and that turns out to be true, it's good news for vaccine development, and it's also good news for informing schools and businesses based on antibody testing who's safe to kind of come back. And depending on how prevalent the antibodies are in our society, that may adjust how socially distanced we have to be. So certainly this information is going to be very valuable. Unfortunately, like everything in this epidemic, we're learning about how to use the test as we're rolling it out. And that puts us at a disadvantage, and it takes some time to sort that out.
One thing, finally, Doctor, that I know a lot of folks in your profession were in the middle of it. You were dealing with a pandemic, let's say it's early March, and people look around the air and say, where are the rest of the emergency room patients, the patients that would normally come in here for other stuff? Talk about, there's a consequence that also, I know one person who went to a pediatrician, and they were the only person there, and they asked the doctor, well, I have to get my kids vaccines. Where are the rest of them? And he goes, I'd like to know. Talk about some of the unintended consequences of what's happened really in medicine in the last few months and the concerns that come along with them.
Yeah, I think that's one of the concerns we have now is we're seeing historically low numbers in our emergency departments, things that shouldn't change, like the number of heart attacks that we see, which is a number that's pretty steady based on our population size, have gone down. They're presenting to the emergency department 40% less than we would expect them to be. The thing that has gone up that's a very scary number is the number of out-of-hospital cardiac arrests. So we do think that people are afraid to go to the hospital. We think that they're afraid to go to the emergency room. And unfortunately, we're seeing people that I think are delaying their care long enough that they're actually having a worse outcome because of it. And so we're really trying to reverse messaging on this and say, the emergency departments, we're doing a good job with infection control. We're keeping COVID positive patients separate from COVID negative. The risk of getting an infection in the emergency department is pretty low. And we really want people to not delay, especially if they have symptoms of a life-threatening disease like a stroke or a heart attack. Please come to the emergency room. That's something that is much more dangerous to you than the threat of getting coronavirus.
And I would assume the same thing goes for vaccines. When kids are supposed to get vaccines, get the vaccines. The last thing I would think anybody needs is more outbreaks of measles or things that we thought we conquered a generation ago.
Yeah, I mean, we need vaccination rates to stay very, very high. It's very important because we want to make sure, you want to be absolutely certain that when your kid comes in with a febrile illness, that it's not from another vaccine preventable infection, even flu next year, because it's going to complicate our coronavirus care. It's going to complicate dealing with any future waves, and it's preventable illness. So let's prevent as much illness as we can as this health system goes through its this stressful period.
Hey, Doctor, thanks for the time. Thanks for everything you do here, and stay safe. I appreciate it.
Thanks for having me.
All right, everyone. We will pivot from medicine to one Jared Kushner, and he's at it again. The president's son-in-law now talking about whether or not he can delay Election Day. Short answer is he cannot, and neither can his father-in-law, even for that matter. After the break, a woman who used to work directly for Jared Kushner joins us with an inside look at what he's really like. Trust me, it ain't pretty.